So the topic I chose today, yeah, I'm kneeling down because you won't be able to see me. But the topic I chose was normal pressure hydrocephalus. What is normal pressure hydrocephalus? So let's break it down. For all the med term people, let's break down hydrocephalus. Hydro meaning water, cephalus meaning in the head. So it means water in the head. But in its terms, the water is equal to cerebral spinal fluid. So it's like excess cerebral spinal fluid within the brain. This causes like intracranial pressures within the brain, which leads to like headaches, a swelled head, and many other cases. Etiology. What causes normal pressure hydrocephalus? 50% of hydrocephalus is idiopathic, meaning that we don't know the cause, it just happens. And then the other 50% leads to like trauma, meningitis, post-operative conditions like failures in surgeries in the head, what's it called, infections, and also hemorrhages. Pathophysiology. Normal pressure hydrocephalus is different from hydrocephalus. So the difference in these two is that normal pressure hydrocephalus, it develops slowly in a more gradual stage, rather than hydrocephalus is more rampant and acute. Cerebral spinal fluid is stored within the ventricles of the brain. I don't have any pictures, but I believe we had one in class where we saw a normal brain size and its ventricles, and we saw a hydrocephalus patient, and you saw how big a hydrocephalus patient's brain or the ventricles in the brain were compared to a normal patient. You'll see an abnormal sized ventricle in the person's head. The symptoms of this include dementia. With dementia, you get forgetfulness, decreased attention, aphasia, memory loss, and even bradyphrenia. We also get abnormal gait, meaning a difficulty walking or a weird type of walk. We also get Alzheimer's disease. It can transition into Alzheimer's disease. You get a loss of your urinary bladder, which means you can pee on yourself at any random moment, and some other brain processing issues. And like I said before, you get an abnormally large head due to the swelling. Onset. This condition happens when the normal drainage of the cerebral spinal fluid doesn't work properly. Some individuals develop this at birth, and some individuals get this later on in life when they get older. This usually affects individuals within the age of like 40 to 60 when we see it in their later life, or you can see it at birth. Neuropsychological processes that are preserved. Compared to Alzheimer's and dementia, you get your recognition memory and episodic memory. Those are preserved, and you can still swing your arms normally. Like some kinetic motions are still preserved. The social and emotional toll that the disease happens or it takes a toll on is that you feel self-conscious in yourself. Why? Because you may use the bathroom randomly in public. Your job may be failing due to your hydrocephalus. You get low memory, forgetfulness. You may forget to do your work. You may forget to go to work, even at that. Being with your family, you get a disconnection. So you may forget your family member's name or something. You may forget who they are. That could bring like a disconnection within the family. Embarrassment, like I said, urinary discharge, abnormal walking, sleep disturbances. You have a swelled head. So how do we diagnose this? The diagnostic criteria is that it's usually over the ages of 40 years old. It's a progressive symptom or a progressive disease, meaning that it usually happens within a 3-month span. and it's non-acute. The CSF opening pressures begin within 70 to 245 millimeters of H2O. MRIs show an index, they call it an Evans index of at least 0.2 or 0.3, and a history of gait disturbances, meaning that you have a history of walking abnormally. And urinary discharge, it's called urinary incontinence. Importance of neuropsychological assessments and what tools are used. So the importance of these assessments, it provides a basis of understanding of what's going on and how to differentiate the differential diagnoses, meaning that we could cross out Alzheimer's, we can cross out dementia and other impairments to the head or impairments to the brain. We can also track the assessment or the progression of the disease as well. And we can also make like an efficient treatment plan for this disease. Some tests that are used is an IQ test to see the person's intelligence, whether it's deteriorated. A geriatric depression scale. Usually those with this disease are really depressed. An apathy evaluation scale, a quality of life scale, and a dementia scale, so we can rule out dementia. Challenges with the assessments. Basically, you can have a systematic mistakes made during the assessment. One could put in the wrong answer. One could just not one could just not have like a fear of test, personal beliefs, fear, anxiety could also take a toll. Sometimes the tests are not really efficient, so we have to take more of an invasive type of role in getting the right type of diagnosis. So you don't get a clear picture of what's really going on. So then we have to, then MRIs and CT scans had to be played in. The treatment plan of this disease is usually surgical because it's fluid in the head and that fluid has to be drained out. Shunts is like a tube, a tiny tube that's placed within the ventricles of the brain, and it goes all the way down into the stomach, and that cerebrospinal fluid in the brain is drained into the stomach where it's absorbed into the body and reused. Usually when this procedure is done, it usually reduces the swelling and pressure within the brain, and usually their head sizes are back to normal, the pressure is reduced within the brain, and the patients are usually back to normal. And there's also a drug, I don't know how to pronounce it, it's called acetazolamide diamix, I don't know how to say it. But this drug is used to reduce the production of cerebrospinal fluid in the brain in clinical cases, and has raised or decreased intracranial pressures. Usually after the surgeries, the physicians will instruct the patient to follow up 2 to 3 times a year to see if there's any fluid buildup or fluid coming back within the brain, to see it has to be drained again. Usually these tests, not all the time, but rarely, these tests have shown to be fail, not really relieve the patient of this cerebrospinal fluid. So then there's a different type of treatment that is done to promote healing. Bedside examinations are done following the CT scans a couple weeks later. Physical therapy, since we have bad locomotion, physical therapy is a good promotion to improve movement abilities, getting back to your daily lifestyle, walking, running, doing whatever you can do. Um, NPH is always or usually reversible because it's just fluid in the brain, and that fluid just has to get drained. The gaps in the literature. When I was reading this, there's several gaps in this literature. First one is idiopathic, meaning that we don't know how it's caused. I feel as though we can do more research to discover how to get a better understanding of this disease. We can, what I would suggest is we can just get a group of individuals willing to participate in a study, knowing that they have NPH, and watch how they progress with this disease, and see if we can discover, because my thoughts are going out all over the place, but usually NPH develops into Alzheimer's disease. So I feel as though we can get a better understanding to discover how this disease, NPH, transitions into Alzheimer's. So getting a group of individuals that have NPH and watch them for like a couple of years, maybe, seeing if this disease and how this disease goes and transitions into Alzheimer's. That could be a good incorporation to the study. Due to the reversibility, there seems to be no need to devise like a treatment plan for this disease. Basically, right after you flush the brain out of the intra or the cerebral spinal fluid, the person gets back to normal. Usually, like I said, physical therapy is a good way to get the motion back. We can get them to speech therapy because we have like aphasia, which is difficulty speaking. We could just get them a speech therapist to improve their speech. What else? I would also give them some antibiotics, make sure that the surgery does not follow up in any infections, and give them a diaper maybe, just to help them control their bladder, and so they won't soil themselves in public or wherever. Reference list. So let me go back to the beginning to get us a clearer understanding. So when this disease is caused, we have a huge list of options. We have infections. It could be an infection in the brain. We have hemorrhages. Usually the brain is bleeding, which leads to some type of fluid within the brain getting and swelling up the head. Trauma is also, that's a big one. And meningitis. So for those that don't know what meningitis is, it's an inflammation of the meninges. And we have meninges within our brain and within the dura mater and within our spinal cord, within dura mater as well. So that usually swells up, and that may cause a hindrance in the flow of cerebrospinal fluid, which indicates, or it usually follows up with a buildup of cerebrospinal fluid in the ventricles, leading to this disease. I also put obstructions of mass lesions. Usually that leads to cerebrospinal fluid within the ventricles. And then with the pathophysiology, we see that dementia and Alzheimer's are a big role or a big indicator in this disease. Usually this disease can be mixed up with dementia or Alzheimer's because you can forget, have some cognitive difficulties, remembering things, walking, speech. So that's why these assessments are crucial to denote whether it is Alzheimer's or dementia. But it's more so dementia, a mild form of dementia that transitions into Alzheimer's. We don't want Alzheimer's. That's a no-no. You can't. There's no cure for Alzheimer's. And ventricular enlargement results into an enlarged head. Usually we see this in babies. When you see this in babies, an enlarged head, we usually suggest that is NPH. If we see an abnormally enlarged head in a baby. Let me go on the internet. I do have some pictures of this disease. So this is like a image of a normal brain. This is the ventricles within the brain compared to NPH. As you can see here, this is abnormally big. Something is definitely wrong. There's definitely fluid within this side of the brain of NPH, which can suggest and more so denotes that is a normal pressure hydrocephalus. And then me talking about meningitis, you see how this part is inflamed. It's an infected meninges, and this is a normal one. This part is inflamed and usually interrupts the flow of cerebrospinal fluid within the brain, which acts and thus causes this disease. And here is a picture in how shunts are placed in the brain. You see how they inserted a valve catheter with inside the lateral ventricle, and that catheter is then goes down the spinal cord, goes down towards the left side of the body into the stomach, and thus is drained and absorbed within the stomach to promote reabsorption of this material. And yes, so yep, that is my PowerPoint on normal pressure hydrocephalus. I used 18 minutes. I don't know what else to say. You can look at my face for 2 minutes if you want to. Here's my reference list. I call it a long reference list. Let me see if I can zoom in. I can't zoom in, but thank you. I'll be uploading the PowerPoint on Canvas.